a start, I ask everyone in this room, would you like to move into a nursing home? The answer is always a resounding no. Stigma. There are many negative labels attached to residential care. Let's face it, no one wants to go to a nursing home. As a group of individuals in this room, or society as a whole, we rarely agree on anything, but might come close on the topic of nursing homes. All families struggle with the decision when a loved one is being placed in any kind of long-term care facility. This decision is made with a heavy heart, regardless of ethnicity or culture. Aside from the financial commitment, there are many emotions that come into play when we think about nursing homes: guilt, sadness, anger, concern, and anxiety. And then there is the media. How come they seem to only cover unfavorable stories about nursing homes? What can we do to change this? Maybe we need to showcase the residents as they are seen here, living, laughing, and loving. For me to stand up and speak about the pandemic levels of dementia we are facing, or how the current model is not working, or that we are underfunded, will not help or make people want to live in residential care. Then there is how we constantly deal with the behavioral challenges, the lack of mental health services, and most recently, violence in the workplace. How within current workplace standards, healthcare workers are to be protected from violence without increasing staffing levels. This is nothing that I can do as an individual or a team at Castleview to make a change now. Castleview has followed best practice standards for years. We have a 6% antipsychotic rate, a polypharmacy initiative of 4.1 medication average per resident, and 0 restraints. My hope for healthcare for this population is to live, to laugh, and to love. This is all what I can do at Castleview to change the environment and the perception of residential care. Understanding today, 99% of my residents have some form of degenerative cognitive impairment from moderate to severe. So I put it out to my staff how we can make it better, and my families. Some of the ideas brought forward from staff were more flexibility in care routines, allowing staff to be more actively involved in care planning, and helping them get into relationships with residents and families. And families ask for only one thing: better communication and disclosure, leading to more control and input into care plans. Simply honesty. Saunders in 1976 wrote, "You matter because you are you, and you matter to the last moment of your life. We will do all we can to help you, not only die peacefully, but live until you die." At Castleview, we understand the importance of the recreation department. We have a 7-day per week recreation schedule that runs from 9 a.m. to 6:30 p.m. During the day, there are large group, small group, and one-to-one activities. We regularly encourage staff to get into relationship with the residents, spend time with them. The number one priority, as seen by my pictures of my Castleview residents, is to let them live on their own terms, help them smile and laugh, to bring them joy, and encourage them to have positive relationships, love, with family, staff, and each other. The Alzheimer's Society outlines the ultimate goal of person-centered care is to create partnerships among care home staff, people with dementia, and their families to enhance the quality of life and quality of care of people with these diseases. Some of the Alzheimer's Society themes we use at Castleview are to have dignity and respect. Like all individuals, people diagnosed with dementia are people first. I see people when I look at these pictures. Our care home staff listen to them, honor them, and validate them. We communicate and share complete and unbiased information, and our residents and families are included on an organizational-wide basis. Residents and families are encouraged to give input into recreation schedules. Families are emailed the Castleview Recreation Calendar and invited to attend all activities. Live well, laugh often, love much. And then there is death. Our home is the last stop. We need to stop fearing the topic of death, being open and honest about dying from the start, be brave enough to put ourselves in the resident's place. What would we want if it was us? What do they truly want? Talk about death as a natural progression of life. Remember that dementia is a terminal illness. The BC government states the primary objective is to enhance the quality of life of the individual's remaining life and to ensure they have their families experience as satisfying end of life as possible. As caregivers, we must generally neither hasten or postpone death, help residents live as actively as possible, clearly shown in my slideshow, ensure individuals are free from avoidable distress and suffering and have the ability to laugh, and actively support and love residents and families through bereavement and dying process. The U.S. National Institute on Aging gives us an explanation we should all consider. Our modern culture tends to treat dying as unnatural. Our technology allows us to forestall death, yet we cannot prevent it. Family members need to be informed with great compassion, sensitivity, and patience about the dying process and how natural and inevitable it truly is. The body is shutting down. The natural process of dying means the body no longer wants or needs foods or fluids. This is often viewed as unnatural by caregivers and even some healthcare professionals. However, we need to explore our own feelings and attitudes towards death and dying before we can help families get through this transitional process, this time of loss and change. My feeling is to call it family. We are a family together. All of these people are my family. We treat each other as family. We tear down the barriers and get into relationship with the residents and their loved ones. As a healthcare team, we provide a caring, trusting partnership with all of our families. So as a whole, my hope for healthcare is to assist my family to live, to laugh, and to love. And when it is all said and done, be allowed to die with dignity and respect.